Good morning. I'm Beth Schweitzer, the Seneca County Health Commissioner, and I'm glad to be able to speak with you again today. As we mentioned, we will be doing these live podcasts every Monday, Wednesday, and Friday at 10:30, and I will provide you some updates and information from the local health department. And also from now on, we will have other special guests with us, and this morning we'll have Commissioner Shane Thomas, and he will be speaking to you a little bit later about what's happening on a county level in relationship to COVID-19. As you all likely know by now, Monday evening we did receive notification that we have one positive case of COVID-19 here in the county. That's something we have been preparing for weeks, and that's because we know that community spread is occurring throughout the state and our nation. As is the process when we have a positive case of an infectious disease such as COVID-19 is, we do what's called contact tracing. Our nurses who have been working in infectious disease for many years are the ones that do this, and there are many questions that we ask the patient regarding where they have been in the last 14 days, ask them their travel situation if they have been traveling, where they have been and who they have been in close contact with, who have they been in sustained contact with, and that would mean someone, household members who have been in close contact with them while they have been in self-isolation. And I just want to confirm that just passing someone on the street a few feet away, the chances of getting COVID-19 are rare. But we still want you to be careful with those 6-foot distances. We'll talk a little bit more about that. But we're really talking about those people who they've had sustained contact with. And then those people are asked to self-quarantine for a period of 14 days. One thing that's happened is people have asked us to provide more information about the person who is positive. We cannot do that because that person deserves their personal privacy. In a small community like ours, it would be possible for someone to be identified if we gave more information. As I've said before, we are in community contact anyways, community spread, so you could actually contract the disease from somebody else whom we do not know is positive. But that contact tracing helps us determine just who those people are that need to be notified about spending time with the patient. We have received no additional confirmation of any positive tests, although we are waiting on the return of quite a few, have received negative reports on many. Just to give you an update on the state level, as of 2 o'clock yesterday afternoon, we have 564 cases in 49 counties. I do want to mention that Seneca County did not appear in that list. There is information we have to put into a database that's located at Ohio Department of Health. It takes a while to get that information in, and then they need to upload it, and they need information such as the confirmed positive result. So that may have not been uploaded into their database in time for us to appear on that. I do anticipate that being there today. Today, what I'd really like to do is place an emphasis on how local employers are so important in preventing the spread of COVID-19 in our community. As your health commissioner, I am charged with doing all in my power to keep the citizens of Seneca County safe and healthy. And I'm going to stress what you must do as a responsible business owner to help with that. On March 22nd, Dr. Acton did sign the order that mandates that all non-essential businesses close. There is a very detailed description of what is included in essential businesses, also, although that is open to some interpretation. What businesses need to do and should have done by midnight of March 23rd, when that order went into effect, is to discuss the matter with your team, which includes perhaps your lawyer, trade associations, and each business needs to make a good faith determination of whether the business or operation in whole or in part is essential. Regardless of whether the business is essential or not, work can be done from home, and we suggest that you do that as much as you can. Each business needs to make an effort to reduce its on-site personnel so we have that minimal contact with each other. and have only who you need to make that operation essential. If work needs to be done on site, businesses need to take all precautions to protect their employees, and I'm going to talk about that in a few moments. In this unprecedented time, I understand management is going to have to make some difficult decisions which have difficult consequences for many people. It's impossible to anticipate all situations. The orders are meant to be adaptable. It's important that you consider the orders in the spirit with which they've been written, and that is to prevent the spread of COVID-19 in our community. Local health departments are empowered to interpret the orders and enforce those interpretations. And of course, each situation will vary across the state, and so will the response. But please, I just beg of you as an employer, if you are one of those businesses that is essential, you need to be a responsible employer. We've been getting many calls from employees who are concerned about processes and guidelines that do not seem to be followed. So I want to encourage you to make sure you provide that opportunity for your employees to follow the social distancing rules of 6 feet apart at least while they are working and while they are taking breaks. Please do not allow your employees to congregate in break rooms or in the cafeteria. Also, have available hand sanitizer that they can use, and give employees sufficient breaks to go wash their hands as they need to. You should be diligent in cleaning those surfaces that are touched in common areas. And we want you to use the proper cleansers to do that. I've read that the virus can live on stainless steel for 2 days and on plastic for 3, so this is really crucial. You keep those areas clean. Be generous in sick time for employees. I know here at the health department we have relaxed our requirements so that we give all employees that necessary time off that they may need. Please, employees should not come to work when they are sick. That is one thing that we really want to avoid. Have them take their temperature and report to you it is all right, or take their temperature when they walk in. You don't have to write down what that is or say what that is, but you should be monitoring those temperatures. Ask your employees how they are feeling. Just care about what's going on with them. And please, if you are not an essential business, follow the director's orders. For employees, we want to remind you to avoid meeting people face-to-face if you are still in the workplace. Employees are encouraged to use the telephone, online conferencing, email, or instant messaging to conduct business, and that is possible. I know here we, instead of walking down to the office to talk to someone, we use email or we use the telephone. If a face-to-face meeting is unavoidable, minimize the time, stay that 6 feet distance from each other, and avoid person-to-person contact through shaking hands and such. Avoid any necessary travel, cancel non-essential meetings, gatherings, workshops. Don't congregate in workrooms, pantries, copier rooms, or any other areas where people tend to congregate. Bring your lunch, eat at your own desk or away from others, and please do not bring food in from home for employees to share jointly. Also encourage members and others to request their information via phone and email, because that will minimize that person-to-person contact. If we all work together to care for each other and follow the directives of Governor DeWine and Dr. Amy Acton, I know that we can make a difference. I can't think of anything better than knowing that your actions may actually have prevented a death. My staff and I thank you for your support, and I promise we will do everything we can to protect you. As I said, I'm joined by Commissioner Shane Thomas this morning, and I'll turn it over to him, and he can provide you with information that he has. And you can keep sending your questions in by Facebook, and we will answer those.
Okay, good. Yeah, I want to thank the Joint Health Department and Beth, especially Beth, for your hard work. I mean, we're very fortunate to have you in this role right now. There's great level of cooperation and communication within our community, so I really appreciate all that. This really is a point in history that escapes definition. We hear a lot of different adjectives used to it, but it's impacted us socially and economically. It's really a black swan. This is a event that's rare and devastating. So we have to come to grips now with the fact that this pandemic will forever change the way we live our lives. We are resilient, we'll come back stronger than ever, but life's going to be different, and we have to come to grips with that. Right now our job is to slow the spread until we get the all clear from the governor. In Seneca County, we have used our remote geographic location to our advantage. This has given us lead time. The lead time to start the social distancing, lead time to adopt the better practices in our businesses, to plan our contingencies, stand up our communication infrastructure, and inventory our response assets. So we have been able to learn from the examples of other communities across the globe that have already dealt with this. Our discussion started a month ago on how we were going to respond, and so we're blessed to have the right people in the right chairs at this time. The lines of communications between the county and the city are open. I talk regularly to my colleagues in other counties, so these are all positive attributes to where we're at right now. Tomorrow, I anticipate us taking action to declare a state of emergency in Seneca County. This doesn't change the action on the ground. We've been acting in this fashion since inception, and those messages are coming directly from the state, but this may allow us to access some additional disaster relief funds. It may also alleviate some administrative burdens as necessary. And there might be some opportunity for us to conduct meetings in a different way. As we speak, the legislature is coming into session to discuss some relief for the administrative burdens that are on counties and municipalities. So we're looking forward to what that package may be. If you want to do business with the county, please call ahead. They will direct you, but you should know that county business is continuing. It's just continuing in a different way. Assume that the building or the county agency is closed to the public. Call ahead and they will direct you. We've all been drafted to do our part in this crisis. I joined Beth in calling on everybody to follow the CDC and Health Department guidelines. This gives our first responders and our healthcare professionals and our vulnerable citizens the best chance against the virus right now. And so, although we are temporarily apart physically, Beth and I are 6 feet apart, we are connected. We're connected in this belief that our community is strong and the people are resilient, and I have the highest confidence that the whole county will emerge from this even stronger and more resilient and be the best we can ever be. I want to thank everyone who has risen to the occasion. So many great stories of people doing tremendous acts of kindness. I thank you. We all thank you. We're pulling together and we're doing our part to slow the spread. And I ask you to all join us in that. Do you want to look at questions? Are there any that we should... Do you have any
questions? One I had from earlier, someone asked about the cloth masks that are being made by people in the community. Are they effective? My answer is they are more effective than nothing. We are lucky enough. We received a small amount of personal protective equipment that our EMA director, John Spar, our county EMS director, Ken Majors, and I sat down yesterday and determined how we were going to distribute that. And we are asking people what they need. Those can be used, though, if it came to a point where there was no professional personal protective equipment, that they would be better than nothing. Some places are actually using those over the N95 masks, which are very protective, so that if they would become soiled, they can remove that handmade one or that surgical mask that's disposable and still continue to use the N95 mask. So that's a way of conserving our equipment.
One question is there no concern for the transfer from all the food that's being carried out or delivered?
I will tell you that we have our food inspectors, our sanitarians in there inspecting to make sure that the food source remains viable and healthy. We don't have a foodborne outbreak. If people follow the guidelines of washing their hands before they prepare food, after they go to the bathroom, after they've touched anything that's a common area or touched anything before preparing that food, placing it in the container and handing it to the person and keeping that 6-foot distance, whether they place it on a counter or whatever, keeping those countertops clean by disinfecting them regularly, that should minimize the spread if we're all, again, doing those recommendations we have been providing.
Are you able to tell us how many people in Tiffin have been tested to date?
We discussed that this morning. You were in the meeting, Amanda. Do you by any chance remember? I think we're up to at least 28
in all of Seneca County.
In all of Seneca County. You got to understand, we may not know about all of them because some private providers have been sending tests to commercial labs. We don't always get the information that they have tested them. We do, of course, get information from the Ohio Department of Health, the tests we have sent there. They let us know whether they're negative or positive. The commercial labs are letting us know only about the positives. So there could be many that are done that are negative and we do not know about.
That's all the questions.
That's all the questions for now. You are more than welcome to continue to post on our Facebook and ask those questions. I will try to answer those on our podcasts, or if we have the time, I will try to get back with you. I'll tell you, our nurses and I have been receiving many calls, our environmental department as well, and we try to take those calls personally, or if we have to take messages, we call back and get the answers to you as quickly as we can.